We always think we're the fault of something because we got a mental challenge. Newsflash, we're not. We're just like you all, because I can ask everybody one question and can't nobody answer that question. Name me one person on God's green earth that doesn't have a mental challenge.
Welcome to My Healthy Mind. I'm Michael Hunter. Today we'll be talking about a remarkable human services organization that has given so much help and so much hope to so many living in the Metro Detroit area. And we'll hear the personal story of Michael Squirewell, a man born into poverty and violence in Detroit's notorious Brewster housing projects. A man who, despite the toxic influence of Detroit's most infamous youth gang, despite severe mental illness and substance abuse, found help, hope, and a new life through the DWIHN Integrated Health Network. Stay with us. Here with me now is Eric Doeh, CEO of the DWIHN Integrated Health Network. Eric, welcome back to My Healthy Mind.
Thank you so much, Michael. Thank you again for having me. It's nice to see you.
Absolutely. Eric, can you start out by telling us what exactly is the DWIHN Integrated Health Network?
Okay. Well, we are a nonprofit organization. We work directly with the state, in particular the Michigan Department of Health and Human Services. So we provide, when it comes to mental health, behavioral health services, substance use disorder services for women, men, and children. And we do so with a provider network of over 300 providers. And one of the things that we did, recognizing, Michael, that there would be such a need, we brought our access services in-house, meaning, unlike before where someone had to call another vendor to then get in touch with us, you can get in touch with us 24/7. Our access line is right there. And what it enables us to do is to link folks who want and need services directly with the provider network whom we're in contract with.
And you said mental health, substance abuse.
Yes.
So if we're talking about a multifaceted of service delivery, what would be an example of mental health where somebody would reach out to DWIHN?
So let's say, for example, you have a child who has a serious emotional distress, or you are an adult, who has intellectual disability. Those are the types of, resources that we offer in terms of being able to provide, whether you're talking about assessments, treatments, through the provider network. And there are outpatient services that are provided. Sometimes there are hospitalization that's necessary, that too is provided. But then too, we have our residential community, because one of the things that we want people to be able to do is to live within their community. So we have well over 200 residential providers who, have homes where people live. This is where they live, and providers then come into those homes to provide services, or through an outpatient basis, members can go to our 300 or so providers. We provide more than mental health services. We provide also, and we link folks to physical health services. So we want to be able to do away with stigma, connect people to resources and care. So you mentioned institutions, because sometimes that's how folks, think of mental health. We don't have those anymore. There was a recognition that people thrive in their communities. And Michael, folks are no different than you and I. They simply are trying to connect. And sometimes there are folks whom we're just trying to get stable because of some difficulties and challenges that they have. We may sometimes have a situation where someone goes to the ER, and because something has happened. Well, the emergency department, it's not a place to solve or to assess necessarily mental health challenges and difficulties. So those folks will reach out to us. What has also been done, you mentioned our law enforcement community. There's a reason why, Michael, law enforcement is law enforcement, to keep peace and make sure that you are there, to come to the aid of folks when, there's a danger or something is needed along those lines. They're not a health care agency, but it doesn't mean that they cannot become a community resource as well. So one of the things that we've done, was to train our law enforcement folks, in CIT, crisis response. We took that a step further. We embedded clinicians within the dispatch centers. So now when folks call, instead of necessarily speaking with a law enforcement person, they're speaking with an actual clinician.
And if a person engages and starts services, is there a time limit? Do they get like just 10 visits, 3 visits, 4 visits? How does that work?
No time limit whatsoever. Life is an amazing thing, and I always try to tell folks so that they kind of recognize that in life you go through ups and downs, and there are no numbers in how many chances you are given on those ups and downs. So why should we set some limitations there? We want folks to be able to get better. We want folks to have resources so that they can get better. And how do you do that when you place, some type of utilization margin on how far or how much, services that they can use? We don't do so. If there is a need, we'll fulfill that need. I mean, we have to be cognizant of taxpayers' dollars. Michael, my number one job is to improve the quality of life of people.
And when a person engages, is there a waiting period?
Absolutely not. We will always have a place for folks to receive services.
And what's my experience going to be?
What a wonderful question. When you go in, there is a professionalism that takes place in terms of that front desk to welcome you, because that's what I would want if it were me, if it were my family member, so you have that. Then there is an assessment that is done, because first, there has to be a determination as to what level of care that is necessary for you. And once that assessment is then done, there is a period in which, it is then determined as to how often you're going to come in to see that clinician. You are linked with a case manager. Just like on the physical health side, that case manager is going to follow you all the way through. You might be in a residential setting. The case manager is also going to be partly connected to that residential setting to make sure that your services, are being provided adequately.
If I bought into my mental health recovery and I'm hungry, I'm homeless,
Wow.
Does DWIHN have any resources for that?
Absolutely, because, I tell folks, Michael, when you and I make appointments for our physical health, right, our docs are not concerned as to how we're going to get there, whether we have a roof above our head, whether we've had food to eat. Within this space here, we got to be cognizant of that because we serve the public, the general public. Doesn't matter whether you're insured, you're uninsured, we serve everybody. And so there are some folks who are transient, and we have to recognize that. And so we want to be able to provide holistic care. Because Michael, what good does it serve someone to have all of the resources for mental health services when they have nothing in their belly to eat?
When it comes to residential, tell me a little bit about that. I can understand outpatient, like I can picture a doctor's office, but what do you mean by residential?
Sure. So, our folks are not disconnected from others. They have family members just as we do. They need a place to stay just like we do. So we have members who live in residential setting. Some of them, many of them, can definitely perform and do for themselves, but they may still need those, care, those personal type care and services. So you have in that residential setting where they live, they may need the help of sometimes even brushing their teeth. They may need sometimes the help of being able to eat. Besides the physical, health challenges that they have, there's also the mental health challenges. And so within that setting, our direct care workers, talk about extraordinary people being able to provide for our folks in that setting.
But residential it's not an institution. It's
Not at all.
It's a house.
It is an actual house. It's a house where folks live. They have the freedom to leave. They have the ability to go see their families. They have their ability to go shopping. They have the ability to interact with each other. Most of the times is a setting of somewhere between 2 to 6 folks. So obviously there are rooms. It is a place where folks live in their communities.
Let's talk about substance abuse. As an integrated network, mental health and substance abuse oftentimes go hand in hand.
Yes.
what kind of resources are there for people suffering from substance abuse, and or like maybe they have both, or maybe they just have substance abuse?
So you see now, and this is where the fancy clinicians have taught me that it is called co-occurring, okay? So can you imagine saying that a couple of times? So within the SUD community, the substance use disorder community, we have prevention and treatment, and on the prevention side, there are preventative measures that are put in place. But think about what the opioid, crisis has done to many of our communities. Having treatment, centers within our communities, within the provider network, has also become very important as well, and we provide that. Having residential settings within the SUD communities, we've also provided that. So when it comes to things like detox, we have providers who provide those types of services. When it comes to women who are pregnant but are also experiencing the challenges of substance use, disorder, we have providers, who can step in and provide resources on those lines.
And for those people who are struggling, I hear this a lot, relapse is a part of recovery. If a person fails and then disappears, for a lack of a better term, away from services, can they come back?
Absolutely. And Michael, it's like, I don't want us to look at this as failure, because through life, we stumble and we get up, and the old saying is like, why do you fall down? So that you're able to get up again. That's all it is, And so we know that regardless of whether it's substance use disorder, folks are going to come across challenges, and we don't want to create barriers. We want you to know that there's a first, there's a second, a third, a fourth, a fifth, however many times and chances you need, we're going to offer that. Because I can't determine for you, Michael, as to what point you're going to recognize that you need that help. I can't determine for you as to when you leave here, what environment you're going to encounter that may influence you to revert. So the best that I can do is to set up that shop and resources to make sure that when those relapse moments come about, that there's a place that's here and willing to help you.
And the network helps adults and children.
Yes.
Approximately how many people would you say are served by Detroit-Wayne Integrated Health Network?
Wow. Last year alone, Michael, as in terms of our core members, 75,000, but we were able to serve well over 200,000 folks last year. I bet you, Michael, that there are significant numbers of folks out here who can use our services and may not know. Over 75% of folks who need mental health services go without those services, and that's because for many of them, they don't know where to turn to. Crisis services. There's a reason why people are showing up in your emergency departments who don't need emergency care, but instead need to perhaps be connected to a provider or need some type of service that isn't on that emergency level.
And now that you mentioned crisis, does Detroit-Wayne get involved in an initiative, I'm sure they do, for suicide prevention?
Absolutely. Look, within our African-American communities alone, the suicide rate has gone up some 200% amongst our young men, African-American men. And it has been the same, for, folks of color. That's significant for us, So besides having, youth programs, our suicide prevention, that's sponsored by our youth section and children's section.
How does Detroit-Wayne handle COVID? Because besides the physical health side of it, there's a lot of mental health side of it as well.
Absolutely. Michael, and oftentimes I think of our children in this regard. I think we talk so much about their resiliency, and I think sometimes we take for granted. Look, when you and I went to school, the most we probably had to deal with was someone who made fun of how our hairs were cut, or made fun of the shoes that we wore, or the fact that we wore glasses, all of that. Nowadays, some of the things that kids have to deal with are far beyond that. Besides the shooting, of course, in Oxford, the scare that happened in Canton, COVID has changed things for our children. I can't remember the day that my 6-year-old went to school and didn't wear a mask. That's something that she has become conditioned to, okay? So one of the things that we did very early on was to be able to invest in PPE, because we wanted to equip our providers with the necessary, protective gear that they would need to serve the folks we provide services for. But we went beyond that. We also recognized too that when testing became a part of just how we live our life, we teamed up with Fort X and Wayne Health to provide, COVID testing, COVID vaccine. We took it even further. So recognizing that people were not necessarily going to be going to buildings to receive services, we had mobile vans where we went to different places, as we continuously do now, to make sure that people are receiving their COVID shots, their COVID vaccine, preventative care services. Those are all things, Michael, we had to do things differently.
Are there services like Detroit-Wayne Integrated Health Network in the state of Michigan or just in Wayne County?
Oh my gosh, we have it across the state.
That's awesome. So if somebody from Ingham County called the Detroit-Wayne number, Detroit-Wayne would be able to direct them to their local resources.
Not only, Michael, will I be able to direct them to their local offices, first I would want to determine the services that they need right now, because, Michael, that may be our one and only chance to connect with someone. So the time it's going to take me to necessarily connect that person with someplace else, why can't I do that now? I'll do it now. Call Ingham County to say, hey, I've linked one of your members or one of your potential members to services. Let's deal with that fancy word code for on another level, but let's get this person the help right now.
And Eric, for all of these services, they're all free?
Absolutely. If the services are required, we will make sure that they are provided.
Next time you need to see a doctor, don't go to a doctor. Call Team Wellness Online. With Team Wellness Online, you can see a doctor or a therapist without waiting, usually within 24 hours. Your televisit is private and 100% secure, and you can take all the time you want. So next time you need to see a doctor or therapist, call Team Wellness Online at 888-813-TEAM to make a virtual appointment, and we'll come to you.
At Team Wellness Primary Care Center, you will find all the basic services you need to be well and stay well. Come in for all your screenings. Come in for routine physicals and checkups. Come in for full-service dentistry. Come in for vaccinations and immunizations. At Team Wellness Primary Care Center, we take care of your total health. Team Wellness Primary Care Center. Come on in.
My mother and father brought me up. We stayed in Brewster Projects, 3010 Bobian. It was kind of like rough back then in the 60s. We didn't have a lot. Basically, my father worked at Ford, but he was laid off. And so, we were getting food stamps and living kind of wretched in a way. For me, it was rough because I couldn't read or write. And a lot of times kids would tease you and that hurt will be there. I feel that even today sometimes, when I'm around certain people and they tease the person, oh, you can't read, you can't, and there go I. I look at that and, like I said, when I got on the west side, I got with YBI, Young Boys Incorporated. And the reason why I did, because I wanted to be, quote, unquote, that guy. And so my defense mechanism was my fist. And, got in a lot of trouble with it, got into a lot of fights with it, and this, that, and other. I affiliated myself with them. I used to sell drugs, and I became my best customer. I remember the times when I jumped in the garbage can dumpster just to get high, just to stay away, avoid the police, It was crazy back then. The reason why I got out of Young Boys, because we started recruiting people at 10, 11, 12, and I had kids at that time. How would I want my kids to look at me or look at living that type of life? My learning ability put me in special ed. And so, I went to all boys school, like I say, ELSTON. And I felt like I was out of place, that didn't nobody understand. You know, we didn't have the mental facilities or the help we have today. You know, back then it wasn't called mental, it was called retardation or somewhere like that, you know. And so that used to hurt, just the mere words sometimes, or how people put things. And, you know, it was never always, I don't know, to me it just ain't right, you know, to put somebody down. We always think we're the fault of something because we got a mental challenge. Newsflash, we're not. We're just like you all, because I can ask everybody one question and can't nobody answer that question. Name me one person on God's green earth that doesn't have a mental challenge. I didn't do none of this on my own. I had a group of people, I had support, I had help. I had people that believed in me when I didn't believe in me. That's the strength of being in Detroit Wayne Integrated Health. The strength is, it's not about you or me, it's a us, it's a we program, not an I program, but a we, because it takes all of us to build this, all of us. It was a team that showed me what I can do when I thought what I couldn't do. It was a team that showed me, hey, believing in myself when I didn't believe in myself. But the one thing about that team, they became friends to the point they became family. That's my family these days, because without them, I don't think I would have ever heard my mother say how proud she was of me before she died. And life for me now, I don't have to look behind my back. I don't have to, if somebody say, hey, Mike, you know, I ain't got to say, hey, who's that, or what's going on, or duck, or none of that. I can hold my head up high today. I can say, God has truly kept his arms around me to give the message. But the key part of that message, he put it here in my heart, in my soul, in my being. And this is what I rest my life with today.
There are many stories similar to Michael's, and those that are, you know, much more amplified along the same levels. And one of the amazing things, Michael, that a person like Michael Squirewell is able to offer for us, it's not only an insight as to where he's been and where he is now. The portion that I know of right now is the Michael who's able to help others who've been through those difficult places that he's been through. And to have someone who's part of our ambassador program, to have someone who's able, you know, to now link folks to services, to now offer what he's learned, you know, what he's been through. I think it's just amazing. And I find that to be one of the best things that we can offer in this space. You and I, we have these great jobs and we're able to do these wonderful things. But can you imagine someone who's been through the trials and tribulations of just life, being able to offer their experiences and their shared and learned experiences with others who are going through the same thing?
It's hope out there. There is a light out there. There is strength out there. I mean, it's not going to come waving you in the magic wand. You got to seek it. But it's there. That light, that beacon is there. I can tell you that, and I know that for a fact, because guess what? I was in the dark. I done seen the light. So we fight this fight together. Please, let's fight it.
If you're having any kind of mental health crisis, we can help. At Team Wellness Crisis Centers, you'll be seen immediately, stabilized in our own private facility, and given all the care you need to get better. Don't wait. Call the Team Wellness Helpline at 1-888-813-TEAM. It could be your lifeline.
I
My job was causing me so much stress.
I felt disconnected and frightened.
I felt so isolated.
I was beginning to feel trapped, depressed. I never expected that to happen to me.
We think nobody else feels the pain that we feel, but that is so untrue.
It's good to be able to talk about it.
I was able to seek help. I found it from Team Wellness.
It's a sense of freedom.
Team Wellness Center. You are not alone.
Thank you for joining us today as we explored the Network of Hope offered by the DWIHN Integrated Health Network through its many public mental health services. If you'd like to learn more about this or any mental health issue, visit us on our website, myhealthymind.com, on Facebook at My Healthy Mind Show, or on Twitter. We'll see you next week for another edition of My Healthy Mind. Let's talk about it. Don't forget to like, share, comment, and subscribe for more content from My Healthy Mind. Let's talk about it.
Until recently, people in psychiatric crisis had very few options. Basically, they could be taken to a hospital emergency room and inpatient treatment, or to jail. But now, there's a better way. Team Wellness Psychiatric Urgent Care Center of Metro Detroit, an official certified community behavioral health clinic. What this means is that now, people experiencing any kind of mental health or substance abuse crisis can be taken immediately and directly into treatment at our safe, certified crisis stabilization unit, to be immediately assessed, stabilized, and triaged by our team of intake medical doctors and psychiatrists, to undergo intensive psychiatric therapy for up to 23 hours in one of our private or semi-private rooms, to be fully evaluated for short-term care and given a warm handoff into proper ongoing treatment, and to receive continuing long-term clinical and peer support services based on a thorough, thoughtful discharge plan drawn up case by case. For those in the throes of a substance abuse crisis, our response would be the effective, evidence-based practice for treating substance abuse, including Suboxone. In cases of attempted suicide, certified suicide prevention specialists are on call, and our mobile crisis response team ready for dispatch. In any mental health emergency, our Psych Urgent Care unit is open 24/7 to receive and treat those in crisis. And in all these cases, law enforcement can bring subjects to Team Wellness to divert from jail or the emergency room. This kind of direct access will save time and save lives. Team Wellness Psychiatric Urgent Care. Certified, safe.